Thank you for the kind introduction, and it's a pleasure to be here today, all the way from Australia. My name is Paul Broadbridge. I lead the eHealth value chain program within NEHTA, so the National eHealth Transition Authority, and have been with NEHTA for about 6 months now. Prior to that, I was with South Australia Health, which is one of our public health jurisdictions in Australia, involved in on-the-ground procurement and supply chain, so implementing Oracle R12 across the state, working through a series of procurement and supply chain transformation projects around organisational redesign, looking at how do we more efficiently both procure and move products through the supply chain. So it's been a great opportunity to take that experience and to apply it nationally within the role in NEHTA. And I'll watch how fast I speak because I know Australians speak really fast. Okay, so I'm going to talk to you today about improving efficiency across the entire health system and the role that NEHTA plays in that. Very much a coordination role working with the public and the private hospitals. More and more though now working with aged care, community pharmacy as well. So looking at the health system from what we I suppose say the ecosystem, so end to end in terms of the health chain. So who is NEHTA? So NEHTA is the National eHealth Transition Authority. It's an organisation which was created by COAG in Australia, the Council of Australian Governments, and effectively we report to the 9 governments of Australia. So that makes things quite complicated at times in terms of keeping all of the governments happy. The work we do is around identifiers, authentication, terminology, secure messaging, clinical documents, and supply chain. And it's very much around how do we ensure we've got interoperability, how do we ensure we're using technology in a standards way, but it's very much about foundational work. So within Australia, how do we ensure we have the right national foundations in place for the states, the territories, the Commonwealth, for solution providers, software providers to actually work within a national framework. So why is the value chain important to eHealth? It's a question I often get asked. I find myself quite often as the only supply chain person in a room, and they say, why are you here? And really it's for 2 reasons for me. It's why I got into this area. Patient safety is first and foremost, and it's an area that quite often in supply chain, historically it wasn't seen as why supply chain was involved. Supply chain was seen as, well, you get something to the dock door, and then it's somebody else's problem. And supply is really only responsible to that. But supply chain has matured significantly within healthcare in the last couple of years to now understanding that it's not just about getting a product to a dock door or to an impress, it's about that end-to-end flow. And importantly, it's about the information that flows around that as well. We know we had a lack of standardised and unique product and location identification, and a partnership with GS1 has been important to resolve that. We know we need to be able to scan and record within clinical systems in your product, the patient, the caregiver, track and trace surgical instruments, use the information available to reduce adverse events, efficiently remove recalled products. We need unique products flowing across the healthcare system, and we need systems to be capable of relating to each other. You know, it's amazing in healthcare today that still doesn't happen. You know, my experience has not always been in healthcare. It was with justice before, and in justice when you ask someone to do things, they normally do it. In healthcare, they nod their heads and that could mean anything. But coming into healthcare, I assumed that, you know, as a younger guy, that the investment in healthcare was, you know, significant. Technology would be fantastic. There would be this connected up system where I was going to learn so much. So I came into health. And I thought, okay, so we'd have these supply systems which would talk to each other. You'd have, you know, across a hospital chain, visibility of inventory, because this is about health. To learn very quickly that that's not the case. And in most hospitals, it's still not the case. So, you know, I can go into a retail outlet and want to buy some clothes, and they might not have my size. And they can tap a few buttons and actually tell me that a store down the road might have them and they can have them up there in the afternoon. So, you know, from an FMCG, from a retail perspective, that's happening, and it has been happening for years. But it's acceptable that it's not happening in healthcare. And, you know, it's really only been the last couple of years that's been a strong push in terms of upgrading systems to make that a possibility, which is, for me, it's been remarkable to say that that's, again, it's healthcare, it's patient safety, it's somebody on a bed who actually requires the right product to be there at the right place in the right time. but it's been the goodwill of our healthcare professionals who have got good relationships with each other to pick up the phone and say, look, if you've got some of X, Y, Z, I need it quickly, not because we've had systems that technology in place to support that. And disparate sources of data, something that I'm quite passionate about. And in Australia, we work very closely with GS1 Australia to address. You would all have your experiences about Excel spreadsheets floating around, or product brochures, but the sources of data in healthcare is ugly, it's diverse, it's complex, it's unstructured, it's unreliable. And we have systems out there, GS1 being one of them, around how can we actually synchronise product information and actually make it more available to everybody who needs it. And inventory, so my bread and butter, reducing wastage, inventory management. It's really is, as we say, a no-brainer. It's something that we should be working on now. It's something we are working on now, but it's something we need far more of an investment to drive faster and quicker to realise the efficiencies that are available. We need to reduce stockouts by better inventory management. That's, it's plain English. Have visibility both within a hospital and across the health system, something now in some of the jurisdictions in Australia for the first time is possible. We can see across the public hospital, across primary care, across the ambulance system, that where the products are across the whole state, which means we can move medical products around to actually reduce wastage. Have the right product to be in the right place at the right time for the right patient. And we need a common language and understand when to apply it. And we need to reduce the administrative burden in asking for the same data in different ways. So NEHTA's value chain program has been in place for 10 years now, scary to say. And it's a strategic partnership with GS1 Australia and GS1 globally, but also with the IHSDO. So we have a framework in place. And it's important to talk about it in terms of a framework because, as a few people have spoken about already, there is multiple organisations involved in this sector, and we actually have to work together as a community to work out how do we ourselves interoperate within those organisations. So in 2006, we established the National Product Catalogue. In 2007, significant work around e-procurement and the uptake of e-procurement within Australia. The Australian Medicines Terminology then came in, which is based on the international SNOMED standard. LocateNet, so location-based services. How do we exchange location information across organisations? And in 2014, RecallNet, which was fantastic. We had a number of pillars in place in terms of how do we get product on the shelf, how do we use structured product identification, location information to actually ensure that happens efficiently, but then how do we get the product off the shelf? And I'm sure everyone has had their experiences within a public hospital system about how effectively recall processes work. Depending on the seriousness of the recall is normally how much everybody scrambles around to check all of the places. A letter will go from the regulator to the hospital to let them know that they need to act on a recall. And then there's a series of normally a couple of days to weeks for that to flow through the system in order for somebody to act in it. So RecallNet was putting in place a workflow-based system which took that from being days to weeks down to minutes. Okay, just to give you a graphical representation very quickly of, I suppose, the end-to-end value chain, supply chain. And I love this slide because you can either talk to it for hopefully about 30 seconds or an hour. So for me, this is good because it shows you how the supply chain is actually larger than quite often what we think. So, my background, I was involved in supply chain in a public jurisdiction. Was used to from a tender and contracting perspective that, you run a tender, someone raises a purchase order, the goods arrive, and, back then, 5 years ago, the delivery ended either at the dock door or if it was around ward box delivery style models at the imprest. But that was where supplier's responsibility ended. It was very much a limited view of supply chain management. So very briefly, you can see here we've got raw materials, manufacture, sponsor, regulator, import, export, distribution, logistics, wholesale, retail, the health service, the hospital storeroom, the care provider, the patient and disposal. So more of an end-to-end, and it doesn't pick up on some of the other parties that are involved in that in terms of community pharmacy, which is quite often where someone engages with the health system very early on. So where does the work that we've been doing with GS1 start to overlap in that? We have a global trade item number, touching all of those parties through the chain. You have a global location number, again, touching all of those different areas. In Australia, we have the prosthesis rebate code. So how does the private hospitals deal with some of the rebate claiming back to the government in terms of revenue? And you can see straight away it's starting to join up the dots, starting to join up all of the different areas, the stakeholders in the value chain. And Australian medicines terminology. So quickly you're starting to get a picture that it actually all overlaps, it integrates. It actually needs to talk to each other, and we need a standardised way in which we do this. So in terms of functions, regulatory, procurement, tendering, logistics, recalls. And so the question is, how do we simplify this? How do we actually bring it together? Within Australia, it was around the National Product Catalogue. So based on GDSN globally, GS1Net, now called the National Product Catalogue in Australia, connecting up all of those sources of information to actually flow it through the whole value chain from end to end. Okay, very quickly to make up some time. Just to give you some numbers, everybody loves a numbers slide. We've got 374,047 GTINs in the National Product Catalogue within Australia. And importantly, it's an increase of 45% in the last couple of years. That has really been around the public jurisdictions mandating through tender processes, because in Australia, different to some other countries, we haven't had a position where the regulator has mandated. So it actually has been a community approach, and it's been the public hospital jurisdictions enforcing through tendering processes, which has given us the uptake that we've required to actually make the changes occur. And representing 1/3 of the healthcare GTINs within GDSN globally, something we're slightly proud of. 478 organisations connected, that's 449 data publishers representing over 90% of the top 100 suppliers into healthcare, and 29 data recipients. So, importantly, again, it's just reinforcing that it's a community. It's an industry. We don't just have 1 or 2 data recipients. We've got 29 data recipients. So when a supplier publishes product and price information into the National Product Catalogue, price is secure between the trading partners, but the remaining data attributes are shared between all. You've got 29 different organisations now actually able to look at that data, to wash over it, to provide feedback in a feedback loop. Now, what happened before the National Product Catalogue was in place? One example for you, in one jurisdiction in a country hospital chain, 66 country hospitals within South Australia in Country Health. Previously, all of those 66 country hospitals would have received a pricing spreadsheet of some form. All 66 would have had to have acted on it and to have done something with it. And if there was an error that one of those hospitals picked up, what they would have done is rung up the sales rep, and it would have been addressed and corrected. But there was a good chance it would not have got reshared to the 65 other organisations in the chain that would have still been acting on incorrect product and price information. In terms of LocateNet, 6,725 GLNs with 219 subscribers exchanging location information. And RecallNet, excitingly, because we're really getting into more of the patient safety area, 144 entities subscribed with 97 recalls or alerts this financial year. So taking that notification time from weeks down to minutes by the use of quite a simple workflow web-based system. Just to give you a couple of the highlight reel, a couple of our success stories within Australia. So the National Blood Authority, has implemented a barcoding standard mandatory for all blood products funded under the National Blood Arrangements in Australia, which uses the ISBT 128 data matrix for all fresh products and the GS1 data matrix for all manufactured. And they're transitioning to new arrangements between 2017 and 2019. They've set minimum requirements for the GS1 data matrix, including GTIN, expiry, batch, lot and serial. They've recently come out only last week in a conference in Sydney and mandated the use of the National Product Catalogue. So we've got another national organisation actually reinforcing its position. And running education programs, really important. So we've got more and more organisations running education programs to educate the sector, which is tremendous. And for more information, it's always great when someone's got a barcoding website. The National Prescribing Service in terms of medicines list, so really in the consumer app space. So the National Prescribing Service has created a medicine list, or Medicine Wise as it's called, which enables a consumer to barcode scan your medicines or select from a pick list. Follow links to more medicine and health information, so it's providing consumers with information around the medicines that they're taking. Allows you to edit, update and print easy to read medicines list. Set alarms for doses, calendar alerts for refilling prescriptions, and record details about your medical tests and have your results graphed. So, very much we're starting to see that it's not just about the public hospital setting, but it's how do we use product information for consumer apps? And how do we actually provide education to consumers, but how do we actually start to integrate, say, recall notifications into consumer-based applications? How do we actually ensure that there's more and more standardised product data flowing through the chain? The Australian Capital Territory, so ACT Health, excitingly they've established a location-based services framework, which very much has the GS1 standards at the centre of everything they do. And it's a real showcase because it shows that rather than having a series of projects that are very specific in terms of how do we use GTIN data or how do we use patient identifiers, they've actually put a framework in place which looks at all of the GS1 standards and how all of the GS1 standards actually work within a public hospital system. It specifies the GS1 identifiers to be used and when, and it's a blueprint for integrated and an interoperable future state for ACT Health. One of the great projects here, and I think there's a poster out in one of the areas outside, is their NICU CAM project, so using standards to provide family with remote camera access to neonates. Positive patient identification, really around pathology collection, so actually starting to use that information in terms of patient care. And an angio suite analysis where a barcode audit was undertaken and they identified 31% of items missing for billing and or revenue. So the theme really here is, there's 10 years worth of work that's been happening in Australia in partnership with GS1, and we're really starting to see now far more of that community conversation, far more of the hospitals actually starting to speak the language in terms of, well, this is why we need to be working with GS1, and this is why it makes sense because GS1 is global, the standards are global, and it actually enables us to integrate across the different areas of healthcare. Ramsey Health, one of our private hospital organisations, was very much an early adopter in terms of the use of e-procurement, focusing on the purchase order, order response and the invoice. They've seen accounts payable, accounts receivable and customer service burden reduced, and they've actually had staffing efficiencies realised as a result of working with NEHTA and GS1 and implementing the EDI e-procurement project. Reduced error rates, improved pricing accuracy and greater lead time visibility, which has been great for them both from an inventory management perspective but also in terms of forecasting and demand management and working with the manufacturers and suppliers in terms of purchasing practices. Fantastic to say that Ramsey has recently done some analysis which they showcased in APEC about a month ago, based on a saving of $35 Australian, based on some numbers there you can see around 84,000 purchase orders and 113 invoices. $6.9 million Australian they realised in 1 year in terms of savings efficiencies. Now, it's great to see because it wasn't around forecast, it was around they realised that saving and they've reported that into their board. 5 million US and 4.5 million euro, just to give you some international exchanges. So that, great example of one organisation actually making real bottom line savings just through adopting a global standard. So in terms of what is NEHTA doing in Australia at the moment, one of the key things happening in Australia is NEHTA is transitioning to the Australian Commission for eHealth. So we are joining up with the Australian Federal Government in terms of the Commonwealth and one of the other areas, Department for Human Services, to create a Commission for eHealth, which is in the process of coming together and will be established by the 1st of July next year. Our work is around sort of strategy. How do we leverage, how do we collaborate and how do we ensure consistency? How do we engage with the broader healthcare, so aged care, pharmacy, consumer portals, and a lot of our work is in that area. Data governance, how do we make sure that we've not just got the public hospital and the supplier there, but solution providers? How do we make sure that everybody that needs to be involved in the conversation is actually participating? Continuing to drive the uptake of our products in terms of the National Product Catalogue, e-procurement, integrating ReCornet into clinical systems, the automated exchange of location information and the use of the standards, and supporting solution providers. Supporting operational proof of concepts and use cases, and continuing to work with GS1 both in Australia and globally on the use of standards within our healthcare setting. So thank you, and the one thing I suppose my take-home message that I reinforce every time I get the chance to stand in front of a room is very much that improvements to the eHealth value chain are an industry community issue, and we have to work together using standards to realise the benefits for stakeholders. It's not something that one organisation or a group of organisations can do, but the only way we can actually drive uptake and adoption is working globally with a group of people such as everybody here today to drive uptake within the global community. So thank you very much.